Hello and welcome to the Royal Society of Medicine OSCE series, a comprehensive set of OSCE video guides covering common clinical examinations and procedures.
Today, Dr. Robbie Rackett, consultant cardiologist, will be taking you through the cardiovascular examination in a step-by-step approach, followed by a more detailed guide focusing on the common clinical signs and pathologies to help you through your exams.
Hello, honey, I'm Dr. Robbie Rackett. Is it all right if I examine you today?
Yes, of course.
Great, would you like to lie there?
Introduce yourself.
Are you comfortable?
Yep.
Great.
Confirm the patient's name and age. Explain the examination and seek consent. Wash your hands. Position the patient at 45 degrees and ensure adequate exposure of chest and arms. Observe for dyspnea and scars. Listen out for an audible mechanical heart valve. Inspect the bedside for paraphernalia including walking aids, GTN spray and cigarettes.
Now look at your hands, please. Turn them over.
Feel for skin temperature to assess peripheral perfusion.
Put the hand down.
Assess for capillary refill time.
Put your fingertips together like so.
Observe the nail beds for peripheral cyanosis and for clubbing.
Great. I'm just going to look at one of your fingers.
Inspect for cigarette tar staining. Inspect for peripheral stigmata of infectious endocarditis, including splinter hemorrhages, Osler nodes, and Janeway lesions.
Just going to feel your pulse.
Palpate the radial pulse with 3 fingers and assess for its key features: rate, rhythm, volume, character.
Now on both sides.
Palpate both radial pulses simultaneously to look for radio-radial delay.
I'm just going to feel for the pulse in your right groin.
Palpate the radial pulse and femoral
Left
pulse
side.
simultaneously to look for radiofemoral delay.
Look up to the ceiling.
Look for conjunctival pallor. Look in and around the eye for signs of hyperlipidemia.
Relax. Open your mouth wide. Touch the roof of the mouth with your tongue.
Inspect the mouth for central cyanosis, a high arched palate, and poor dentition.
And relax. I'm just going to just feel the pulse in your neck.
Palpate the carotid pulse for volume and character. Position the patient at a 45-degree angle with the head turned to the left and locate the double waveform pulsation of the JVP between the sternal and clavicular heads of the sternocleidomastoid. Assess the jugular venous pressure for height and waveform.
You got any pain in your abdomen? No. Do you mind if I just gently press on your tummy? Of course.
Elicit the hepatojugular reflux to confirm position of the JVP. Do this by applying firm pressure to the right upper quadrant and watch for a rise in the level of the JVP pulsations.
I'm now just going to examine your chest, if I may.
Feel for the most infralateral pulsating point of the heart, which is usually in the 5th intercostal space in the mid-clavicular line. Note the character of the apex beat and whether it is displaced. Use the flat of the hand to palpate for thrills over the precordium and for heaves at the left parasternal edge.
I'm going to listen to your heart now. Breathe in. Stop. And breathe away.
Listen over the tricuspid, pulmonary and aortic areas with the diaphragm of the stethoscope,
And breathe away.
and over the mitral area with the bell of the stethoscope. Determine the site, timing, character and pitch of any murmurs and the presence of additional heart sounds.
And relax. Hold your breath. And breathe away.
Auscultate over the carotid pulse and the axilla for radiation of murmurs.
Can you just tilt to the left side and put your left hand behind your head?
Perform reinforcement maneuvers to help detect diastolic murmurs. With the bell on the apex, ask the patient to roll onto his left side and hold his breath in expiration to reinforce the murmur of mitral stenosis.
Thank you. Straighten up again. Sit straight, and if you could lean forward as far as you can, and breathe in.
With the diaphragm over the left
all the way
lower
out.
sternal edge, ask the patient to sit forwards and hold his breath in expiration to reinforce the murmur of aortic regurgitation.
And breathe away. I'm just going to listen to the back of your chest now. Breathe in and out. Breathe in.
Listen for the bibasal crepitations of pulmonary edema.
And relax. Lie back again. So you're going to feel the pulses in your feet and feel your shin.
Apply firm but gentle pressure to the ankle. Residual indentation of the skin after the pressure is released may indicate pitting edema, a sign of fluid overload and heart failure.
Thank you very much.
Thank the patient and help him to dress.
We thank you for watching, and for more information and videos, please go to rsm.co.uk/OSCE series.